It's so accurate now, I've gone totally modeless. Whether it's for crown and bridge or for implant restorations, everything is done totally digital now. It's a game changer. You know, I liken it to the introduction of digital radiography. You know, once you go to it, you can never go back. And I use it for everything. I use it for crown and bridge, I use it for veneers, I use it for bite prosthesis, orthodontics. You can really get in there and get posterior edentulous pads without any issue. You can do the palate. And that's really important because I've started to do a lot of full arch supported dentures, which are totally planned out and staged with a variety of labs. And the accuracy of it in terms of blending it with a CBCT is absolutely phenomenal. It has shortened the amount of time I have to spend with patients. It's been a tremendous, tremendous referral for patients. They love it. They loved having not having to have impressions. And my delivery time and the accuracy of the work that I produce has been cut by 2/3.